about the cholera outbreak. Now, the death toll of cholera-infected victims have continued to rise as Lagos, Oyo, and Kano states record an increase in the number of casualties. According to reports, the outbreak has killed at least 35 people and 417 cases in Lagos. While the major cause remains bad sanitation and polluted water, the government, in collaboration with relevant partners, are engaging in contact tracing and community-based surveillance to reduce the spread. It's a really sad development with regards to this matter of cholera outbreak, the number of persons that have died. And just, I think, over the weekend, Lagos State was talking about a matter of unregistered tiger nut drink when it traced how people were infected, especially to Etiosa local government area. But I'm wondering what we are tracking and tracing with regards to other areas where we have this number of infections in the state, in Lagos State, and then for other states, what they are doing in particular. What we see most of the time is what Lagos State is doing with regards to addressing it, but we do not have as much information with how other states are addressing this matter, and it's important that we deal with it head on to curtail the spread.
And apart from the fact that we also need to, deal with it like you said, we also need to raise awareness on this issue because we had our correspondents go out last week to the street to talk to people about this outbreak, and many of them said they're not aware, and some of the symptoms they saw are probably normal symptoms that they experience on a normal day. And so this is where awareness comes in. And it's also important to know that according to a WashNum report, approximately 48 million Nigerians still engage in open defecation. We had a physician during the weekend on the breakfast who mentioned that the hand is the most utilized, part of the body where is the part of the body where you communicate, you interact with other persons, and so that's the easiest to transmit this disease apart from the oral to oral transmission. And so that's where awareness comes in, talking to people about the need for to wash their hands. It may not be as delicate as the COVID era, but this is also very important.
It is, because if we have lost a number of persons, it means that it is crucial that we pay attention to what we do with our hands, how we maintain sanitation, what we put in our mouths, still using the vehicle of the hands as it is. Well, I just got reports saying that Lagos State has come out to say that it is that talk about unregistered tiger nut drink is false. Oh, okay. So investigations have not been concluded yet, so they are not, narrowing it down to that particularly. Because I recall, I was wondering when I saw the reports, because I recall that I think about a week ago when we celebrated Ilea, and they were talking about what led to the spread was because there were large gatherings. A lot of persons went for the celebration of Eid al-Adha as it is, and so because of that, they did not take necessary caution to just maintain or watch what they ate, and also maintain that consciousness with regards to ensuring that they do not contract this infection as it is. But it's important, like you raised, a critical aspect of awareness and education with regards to this matter. So now, I would like to advise those who are watching us now and those who might watch later, that it's important that you do not self-medicate. Because when people begin to see themselves stooling and all, the next thing they grab is, do I have gari in the house? Or do I have bread so that, the stool can be hard enough, and then all the matters that I'm going through will settle, my stomach will settle and all of it. Once you see that beyond 2 days, or a day, when you notice the stool,
there's a lot. A day.
When you see that you are stooling consistently, then you need to either do the ORS, that's the oral rehydration, oral rehydration system, ORT, oral rehydration therapy as it is, and then you now take care of yourself. That is the major thing you should do in the immediate in the house, so that you can stop stooling or to rehydrate yourself, because as you're stooling, you are dehydrating. And that is where it becomes dangerous. You're losing your electrolytes, you're losing so many things, and the body needs to rehydrate, and then you do the ORS therapy as it is quickly to address it. And then the other matter is that when you notice that you are having abdominal pains, vomiting more than 2 or 3 days, or 1 day, like we rightly mentioned, fever, muscle pain, and all of those other things that you see, and you notice that the color of your stool is whitish, sort of, then you know that you need to quickly go to the nearest hospital.
And it's also very important to let Nigerians know, because the physician we've spoken to many medical practitioners on this issue, and most of them have reiterated on the fact that the vaccines are not even enough to treat this, and that's why we should focus on preventive measures. And you know, some years ago we had, what would I call them? Environmental practitioners, environmental personnel who visited houses to houses. In Yoruba, they call them wole wole. By wole wole, they mean they will come to your street. Yes, come to your house to ensure that you are meeting up to the standards of as regards hygiene and cleanliness, so it does not affect. Because, you know, one individual can also pass this on and on and on, and that's why the Lagos State government is focusing on tracing to find the source of this issue. But as much as we are talking about presentation at the hospital, we also must focus on preventive measures. And
absolutely.
The oral solution, like you mentioned.
And it's important to know how to wash your hands. It's not just put soap in your hands and then that's it. You need to wash every corners of your hands as it is, especially after using perhaps the toilet and every other areas that you use. Whatever you're doing, ensure that you're washing your hands regularly as much as possible.